Hello, it's nice to meet you. I am Jocelyn. A little bit about me. I am 23 years old. I just graduated from nursing school and I'm wanting to pursue my lifelong dream of being an RN. I chose nursing and to be an RN because it has been a lifelong dream of mine to follow in my grandma and my mom's footsteps of being a nurse, which makes this extra special for me and even more of a special journey. For as long as I can remember, I have always wanted to be a nurse, and like kind of like a special moment. My mom has a picture of me from around the age of like 6, 7 years old, like walking around the house in her white coat and stethoscope, pretending to be a nurse just like her. So this is something I definitely have wanted to do for a very long time. I have always wanted to help and care for people and just leave a better mark in someone's life, no matter how big or small. I love being around my family and my friends. I love going to country concerts. I love a good iced coffee. I love traveling and getting to experience new parts of the country or the world. I'm a very compassionate and hardworking and driven person, and I always give 100% of myself and my love to anything that I do. And I have always been told that I have a big heart and I wear my heart on my sleeve, which I totally believe to be true just because of how I always try to make everyone feel special and cared for when they are around me. My motivation to be an RN is my why of wanting to become a nurse. I've always been the person who wants to be able to help in any situation or circumstance if I can. And I think that being able to help or take care of someone on their most vulnerable or darkest days is a privilege that many people I feel take for granted in this field. I have met a lot of nurses who come into this profession because it pays well, and they don't truly care about, the patients and the people that they get to see every day. And that's something that I feel like kind of grinds my gears just a little bit. Because being a nurse is more than just the paycheck. It's coming into work every single day, caring about another human being that isn't yourself, and it's having the life of someone else in your hands and them having unwavering trust in you that you're going to take care of them and you're going to be there for them in any way, shape, or form. And my motivation is to be just that one nurse that someone remembers for the rest of their lives because of the trust and care and respect and compassion that I had for them, and for them to remember that even in like the darkest days or even, in their brightest moment in their health journey or in their life, that they had someone in their corner who was there for them and took care of them. And that's my biggest goal and motivation of being a nurse. And also comes from wanting to be the best possible person I can be for my patients and my coworkers, and to be a nurse who inspires and cares more than anything in the world, and who's always there for their patients. A couple challenges that I can see as an RN. One of them is just having to learn how to handle or understand patient death and how to deal with it. As nurses, we are the closest to our patients and we see them at every stage of their journey. Once they're put into our care, we get to learn about who they are and where they come from, their children, their grandchildren. We get to learn about their husbands, their wives, girlfriends, boyfriends, all these things that make them more than just somebody to care for. So when they don't make it or they pass away, like it just pulls at your heart of losing someone who we got to learn so much about and got to see them in a different state than someone else might have. Another challenge is just the stress of nursing and just the stress of the job, handling patient volume, dealing with patients and their families on a daily basis, working the long hours, the late nights, early mornings, missing out with family and friends, being understaffed. It just puts a strain on the job and, our mental health. And another challenge, lastly, is just to go along with, stress is burnout and having to deal with trauma, death, abuse, nursing shortages, less than environmental conditions, coworkers, if there's management problems or issues, like it all leads to burnout and losing that passion and that love for nursing. And I know that this is my passion and something that I want to do as long as I can. And these challenges are something that I've talked to other nurses and seen them face, and something that I could definitely see, potentially myself facing. And I want to work every day to try and be able to handle them in a positive manner and not lose my love for nursing. If someone, if I ask someone to describe me, I feel like that they would say that I am sweet and caring and kind and compassionate and someone who always puts everyone above myself and someone who loves everyone around her. And I would also think they would say that I'm also a perfectionist, which I very much am, but I am working better to, help with that a little bit because that sometimes can be a little bit of a problem. Some skills that I bring to my role as an RN. One of them is my critical thinking skills. I am very good at working under pressure and making decisions based on, the information and the facts presented in front of me, as well as thinking of things or situations that might be a little bit more outside of the box. I feel I bring, my organization skills and my integrity. I'm very good at making sure I have all my tasks in order and that all my patients have clean and comfortable environments. And my to-do list or my tasks for, the night are always done and completed and they're very organized. And I also feel that I make the effort to always do the right thing, even when no one is watching or even when it doesn't get recognized. And I feel that all patients deserve that kind of care and practice, just because there's a shortcut or an easier out to do something doesn't mean it's always right to do it that way. And lastly, I am hardworking and responsible, and I feel like I bring those skills um, to nursing and their strong skills to have. And I always make sure to give my patients 110% of myself, even when I myself don't always feel like 100% at work. I also take responsibility when it comes to my patient care with my coworkers or with my bosses or management. And if I make a mistake or if I do something wrong, I'm always the first one to speak up and I take responsibility for it. And I always ask how I could have done better or what can I do to fix it for next time or how to avoid that in the future. So definitely always responsible and take responsibility for my actions and my words. How would I describe empathy? I would describe empathy as someone who is able to understand or put themselves in someone else's shoes to truly understand what they may be going through or the feelings that they may be having. Being someone who is empathetic, I feel like really listens to people and their concerns, their feelings, their emotions, their opinions, and they listen without judgment or without spite. And they really take into account the things that someone has gone through or is going through and really tries to feel what they are talking about to make them feel seen, to feel validated, to feel heard. And they truly just try to understand where that person might be coming from, even if they might not have been through that situation themselves. Questions. I do have questions. I have three questions that I would like to ask. Number one is when a nurse is, struggling with like burnout or stress or just having pretty bad mental health from nursing, is there anything in place or any resources to be able to help them with whatever they may need to either get better or to how to deal with that or how to handle that? Question number two is what or how is the relationship between management and the nursing staff? Do they stick up for their nurses when needed? Do they support their nurses? Um, do they realize, that their nurses are, we're humans and we're not just working robots? And question three is what is the environment like between the coworkers, like between coworkers, between nurses and the staff and nurses and the doctors? Is it a friendly and supportive environment? Are there, challenges with that or kind of little clicks here and there? Like, what is that kind of environment like? Thank you so much for the opportunity again, and my name is Jocelyn.